For the girls and women who are talented, passionate, and driven.
For the girls and women who get excited about solving problems using numbers.
For the girls and women who are drawn to cars and want to know how they work.
For girls and women who want to save the planet through technology.
For the girls and women whose passion for something comes easy when their career does not. We see you and understand your interests and desire to make a difference pursuing a career in science, engineering, technology, and math.
We are Trailblazers Live.
Our mission is to create meaningful videos and content that inspires STEM pathways, empower new possibilities for future career pathways, and connect powerfully with women and girls everywhere for an equitable future.
We are ridiculously committed to connecting problems of tomorrow with the people who need to solve them.
We are calling you forth to join us.
Sponsor us and subscribe now.
We are for the girls and women, and our future is waiting.
Hello and welcome to Trailblazers Live. We are excited to bring you our first ever Trailblazers Live panel live from the Kiat Studios in Eagan, Minnesota. Drop us a comment to let us know you're here. We'll have a question and answer portion of this panel, so make sure to submit your questions in the chat either on Facebook or on YouTube. I'm Sarah Patno, the producer of Misfits Media, and I am handling Command Central for our first ever live broadcast today. So I see that there's a couple of people that are tuning in now. Let us know that you're in the chat. Let us know where you're tuning in from. We welcome you to this live broadcast. And so with that being said, let me hand this over to Amanda to get us started.
Hi, good afternoon, everyone. As Sarah mentioned, we are coming to you live from the Kiat Production Studio. I'm your host, Amanda Sidarsky with Misfits Media. Trailblazers Live is the brand evolution of the mentoring event panel model that was originally created by Million Women Mentors Minnesota and Kiat as a vehicle to expose, experience, and encourage more women and girls towards careers in STEM. So why does this movement matter? Here's our motivation behind the movement. The true ways to lift women and girls out of poverty is to enable them with the skill set to be able to apply for careers and jobs and occupations that have salaries above the national average. As you can see in the slide, the economics for women are very quantifiable. 93% out of the 100 STEM occupations have wages above the national average, with an average of $87,000 a year. So why are we evolving our model? Amidst the pandemic, young women at key decision points of their lives have lost several of the common channels that many of them utilized to guide them along their career pathways, such as mentors, career counselors, job shadowing, internships, and even through the Million Women Mentors channels, those corporate tours and panels and experiences that were in person, we aren't able to provide them. So our goal is to provide these young women a virtual alternative through our Trailblazers Live YouTube channel to supplement the absence of these support channels for them to be able to research and learn more about the world of STEM from other young women who have blazed trails before them. Today's panel, I'm very happy to introduce to you Hannah Kiat and Kelsey Sutter that are blazing trails in STEM. So let's kick off our first interview question. Kelsey, tell us about your trailblazing educational journey to become a physical therapist.
All right, well, hello everyone. Like she said, my name is Kelsey. I'm a doctorate of physical therapy student at Creighton University in Omaha, Nebraska. And my journey really started at the University of Minnesota. I got a 4-year degree, a Bachelor of Science in exercise science. And I also had a minor in neuroscience, and I graduated in 2017. And throughout my journey there, I obtained about 200 contact hours of physical therapy shadowing, and also worked as a physical therapy technician. I worked at different physical therapy clinics across the state. I worked at Masonic Children's Hospital, Twin Cities Orthopedics, Courage County Rehabilitation, and also OSI Physical Therapy. And what I did there, working as a physical therapy technician, was just helping the physical therapist, whether it was getting rooms ready for patients or hooking people up on electrical stimulation or ice. I kind of just offered a hand and observed the profession for about 4 years while I was going to school to get my undergraduate degree. And then I applied for PT programs after I graduated, and I took about a year off. And I interviewed for physical therapy programs across the United States. I got into a few, and then I chose Omaha and I chose Creighton University. They were a top-ranked program, and when I interviewed there, it was just a really holistic program that kind of fit everything that I wanted in my doctorate degree. So I started here in 2018, and I'm hoping to graduate in May of 2021. So it's about a 3-year program, and it's about 2 years in the classroom. And then my last year, I've just spent on different clinical rotations. So right now I'm working at an outpatient physical therapy center. I work 4 10-hour shifts a week, and I'm in so I'm doing aquatic physical therapy 2 days a week, and then about 3 days a week I'm in the clinic doing outpatient physical therapy. So that's a little bit about my journey. I'll hand it over to Hannah now, and she'll tell you about hers.
I started out in Texas, actually. So I'm from Minnesota, but I decided to go somewhere new for school. So I went to TCU. I picked TCU mainly because it was a direct entry nursing program. So I started nursing classes my freshman year rather than starting my sophomore or junior year. I loved being down there. So I graduated from there in 2017. And right out of school, I got a job in the ICU or I guess it's called the cardiovascular ICU pipeline program at Abbott. So it was starting on a cardiac floor and then evolving into the ICU. I switched over to Fairview Southdale in 2018, and I've been there ever since. It's kind of a more all-encompassing ICU, so we take care of all kinds of patients rather than just cardiac patients. And currently I'm looking to apply to go back for nurse practitioner. That's kind of my journey.
Awesome. Thank you so much for sharing that with us. All right, Sarah, I'm having an issue with the slides. Bear with us, viewers.
And that's what happens in a live broadcast. Anything can happen. So we just want to say welcome to Carly Johnson for tuning in. Welcome to be here. And if you have any questions for us, leave that in the chat.
All right. So our second question for the panelists. Tell our viewers about yourself and your passions and how what you do, so either a nurse or a physical therapist, aligns with those passions.
Okay. Well, I grew up as a dancer in Minnesota. I've always had a passion for movement and exercise and physical activity. I think that's a big part of what helps us age well as humans. And I think when I went into physical therapy school, I was thinking I'm going to be a physical therapist for dancers only. I'm going to focus on that population. And then what I learned is that I really actually love working with older adults and helping people learn how to age well, how to live well, which really is a rather new concept for our society. So my passions really just, I guess, surround helping people live the best life that they can, help them return to their level of function and achieve whatever goals that they want to do. So as a physical therapist, that's what I get to do every day. And I think it's a really rewarding field, and I'm really excited to be a part of it as a student. I've learned a great deal, and I'm hoping that I can continue my work with older adults once I graduate in May and hopefully get a job helping people age well.
Awesome. Yeah. I would say kind of similar in the I've always kind of wanted to be in a profession that was helping others and being more active rather than I never really saw myself sitting behind a desk. Not that there's anything wrong with that. But I just wanted to do something where I was helping people all day, every day. And so I really get to be a part of a patient's healing journey and going from really sick to either turning the corner or not. And I just love it. I love the interdisciplinary work that I feel like a part of a team. We work with the doctors, we work with physical therapists, we work with all different kinds of fields to best care for the patient population that we are working with. And I've always just I've been really blessed in the fact that I've really always known kind of what I wanted to do. Not necessarily the specific field, but I knew I wanted to go into medicine from a young age. I'm passionate about that. So that's kind of how mine align.
Great. All right. So next question. Take our viewers through what is a day in the life of your career. But I think I'd also love to learn just how the pandemic has affected or impacted what you do, how you do it, where you do it, and how you perform those job responsibilities. This is such a unique situation that we're in. And I really think it's relative, right, to women understanding how a pandemic would also impact the career field that they choose.
Yeah. So for physical therapy, it really depends on your practice setting that you're in. So right now I'm in outpatient physical therapy, but throughout your education as a physical therapist, you're trained in entry level in a bunch of different settings, So you can be trained in acute care, you can be trained in aquatics, you can do skilled nursing, you can do outpatient like where I am. It really just depends on where you are. So typically when I come into work every day, I have a set schedule of what patients I'll be seeing that day. And it varies on how busy the clinic is that day, but I'll typically see anywhere from 12 patients, anywhere from half hour to an hour. And then I have new evaluations on top of that. So I'll take you through what we do in a new eval. So when the patient comes in, they're usually coming in with a certain problem like low back pain or an ankle fracture or cardiovascular issues, something like that. So I sit down with them for about 10 or 15 minutes and I talk to them. I interview them to see what's going on in their life, what they need help with, what are they not able to do now that they want to be able to do, and kind of where I fit in as a physical therapy student, where I fit into that picture. So after the interview, I get them up and moving because what we always say is motion is lotion for our bodies. So I take them through a few different tests and measures is what we call them. I measure range of motion, I measure strength, I do a couple different outcome measures, have them stand up and sit down a few times, have them walk around the clinic. It's all based on what they need to be doing. So after that's done, then I typically put my hands on the patient and I, feel around in their area that's painful. I try to determine if it's a muscle problem, if it's a joint problem, if it's a fascia problem. There's a ton of different things that could be causing their pain. So I get my hands on them and typically try to make them feel a little bit better than when they walked in the door. And that's usually what a full treatment session consists of. But like I said, it depends on what your setting is. If you're in the hospital, like Hannah said, you're usually working with people that are pretty sick. So you might not get them up and moving so much. You might help them get up from the bed and walk them to the bathroom so they can learn how to increase their independence with going to the bathroom so they can get out of the hospital and get home to where they need to be. So it all depends on what setting you end up in, but that's really what a day in the life of a physical therapist looks like. And so in my experience, I was just finishing up my coursework when COVID hit in March. So they transitioned all of our stuff online to finish that out. And we were supposed to be seeing patients every, I think 2 days a week is when we were supposed to be seeing patients. They were coming to Creighton and we were doing a few sessions with them on campus. So I actually got great telehealth experience, which I know a lot of outpatient clinics are having to do now, especially for their older adult patients or patients who are immunosuppressed. They had to get right into those telehealth sessions. So that was a great experience for me. It is not easy to do physical therapy sessions over telehealth, but it's super needed right now for the people that can't be leaving their homes. So I got great experience with that. And now as I'm in the clinic, again, depends on what state you're in and what the regulations are. But typically we just wear masks and we wear goggles. And then if we do have a patient that is immunosuppressed, we try to limit how many people they're coming into contact with. So, patients who have cancer or different comorbidities that are suppressing that immune system, we typically only have one therapist treating them. And then we're, of course, disinfecting all of our equipment and everything that we're working with. And that's pretty much how it's been impacted. But like I said, it all depends on where you are, and it's all changing pretty fast. So we adapt and we're flexible, and we're just right in there when things need to change. So that's been it for me.
Yeah, for me, I never really had the work from home or any of that aspect of COVID, but it kind of, honestly, to be totally frank, it really hasn't changed much for me. It has been pretty steady. Actually, at the beginning of COVID, it was pretty slow in the hospital because I think a lot of people were scared to come into the hospital because for fear of getting something in addition to COVID, or getting COVID in addition to whatever they have. But so like a day in my life would look like I wake up way too early and get to the hospital, and the night shift is just coming off. So get report from them, hear from our manager or the night charge nurse what happened overnight, if there's any concerns, like safety concerns, medication concerns, anything like that. And then we do bedside reports. So we go in the patient's room and receive a report from the night nurse. And then if we have any questions or if they have any pertinent things we need to look at and just put eyes on, we'll do that. And then the night nurse normally leaves and we'll do our full assessment, including just like looking at our monitors, because especially for me in the ICU, it's really important that our monitors are set with the accurate parameters, so that the monitor will essentially beep if one of the parameters isn't being met. And then we'll do an EKG strip, so look at their heart rhythm. And then about 10 o'clock, we have interdisciplinary rounds. So that includes a pharmacist, a doctor, normally a fellow or a resident, dietary, physical therapy, respiratory therapy, care coordination, and chaplain. And so we'll talk through kind of just what every patient is there for, if there's any recommendations, because I feel like it really closes that gap of miscommunication, because a lot of times with so many patients in the hospital, not the whole team doesn't get to talk at once, more than just on rounds. So really take advantage of that. And then honestly, just kind of following what the doctor has planned for the day, making sure that the patient and the family's needs are being communicated to the doctor, because a lot of times with them seeing so many patients that we have to be that voice for the patient. And then kind of just seeing what comes with the day, honestly. It's different every day. Sometimes we're fighting really hard with someone for their life in the ICU, and sometimes we're seeing progress and moving them out of the ICU. So it really just depends. But COVID, so Fairview, this health system that I work for, opened up Bethesda pretty pretty immediately, which is a long-term care facility. They turned it into a COVID hospital. So I haven't seen as much COVID as I was expecting to see, but we keep all patients in the ICU until they're confirmed positive or confirmed negative. And then they get transferred out or stay. And then we kind of just do what we normally do. Level of care or policies and procedures really haven't changed much. But we're in full protective gear with a mask or an N95, a face shield, a hair covering, a gown, and then 2 sets of gloves. So I really haven't felt unsafe during this pandemic. I know we haven't been hit as bad as some of the other states in the US or in the world. But yeah, so come home and decontaminate myself essentially. And then, yeah, just start it all over again the next day.
Awesome. Thank you so much, guys, for sharing those experiences with our viewers. So the next question and the last question, so much about all of our lives is to find a special place in the world where we're not just living out our passions, but we're doing something, we're taking action, and being the change that we want to see. So the last question from me, at least, what are the cool things that your job does, right? That either enhances the lives of others. I know that you talked a little bit about that previously, or really makes the world a better place. I'd love to hear your thoughts in both the physical therapy space as well as nursing, how those points apply.
I think a lot of what we do in physical therapy is really empower our patients and give them back a certain level of independence that they maybe haven't had, whether it's for only a few days after surgery or whether they've been dealing with chronic pain for 20 years. I think we really give them the tools that they need to help live the life that they want to. And it depends, like I said, on what they need, but it can be small things. Like I had a patient yesterday who just wants to be able to open a jar that she hasn't been able to open because her shoulder has been frozen for 10 years. So it's not always really big things like making someone walk again after a spinal cord injury, but sometimes it is. And I think that just seeing the progress over time and seeing that improvement in independence is a really cool thing. And it's not just our patients. It's, they're coming in with their families. We're helping for moms and dads, we're helping their pediatric patients roll over and they haven't been able to roll over and they're 1 year old. I think it's you get to spend more time with your patients and you get to really learn what they need to be able to do. And that makes a really big difference in their lives. So I think that's a really cool thing that we get to do in physical therapy, and we get to be there for the whole journey. And like I said, educating your patients of you were here when you came in, but now we're discharging you and you're able to do all of these things that you want to do. You met all your goals. I think that makes the world a better place, even if it's just a minimal thing. I think it does make a difference.
Yeah, that's awesome. I would say that some of the cool things, I work in the ICU, like I said earlier, and a lot of times it's really, for lack of a better term, fighting with the patient for just to make it to the next day. They're really critically ill. But also coming in, we work like 3 shifts in a row and then we'll be off for a couple of days. The best feeling in the world is coming in after those 3 days and being emotionally taxed and seeing that patient really struggling, and either coming in and seeing that they're at peace or they've turned a corner and are up, and not necessarily up and walking and talking, but talking or nodding their head or able to smile at you. And a lot of times they're on sedation when they're really fighting really hard. So they don't necessarily remember you, but they have smiles on their face, and they're even just as I had a patient the other day that was able to do a thumbs up for the first time in like a month. And it's just so cool to see that. And it's also cool to see the patients that you're sure aren't going to make it and just turn that corner and make it, and we get to join in their fight. And then another cool thing about nursing is there are so many ways you can go with a nursing degree. If you don't want to be bedside, you can go into insurance, you can go into all sorts of things. And then there's all kinds of graduate degrees. Like I'm looking into applying for nurse practitioner. You can go into CRNA, which is really popular, which is a nurse anesthetist. And you can become a midwife and deliver babies. Just so many different things that I don't think you see when you look into a nursing degree, of the vast majority of stuff that you can go and do. And it's really just limitless. You can really go whichever way your passion drives you.
You know what's so funny about this question? I meant it to apply to like the world is a better place, but I actually was a double spinal surgery candidate, not even candidate, 10 years ago, and had a year of physical therapy to really learn how to walk again normally. So it was so fascinating that this question brought out to you guys that for some people, a thumbs up or walking normally again is actually changing their world. Well, you know, that's so powerful, right? Because it doesn't always have to be global. It can be very local and nonetheless just as impactful, even if just to that one person. That's just a really cool, I think, honestly, realization that I even have through our panel today.
Yeah. One more thing I'll add. So with COVID that I forgot to say earlier is now we have one designated visitor, but a lot of our patients that are sedated and intubated and on life support essentially can't have visitors. And if you have COVID, you for sure can't have visitors unless they're removing the ventilator and letting the patient pass. But we get to be that middleman of communication between the family and the doctors, because a lot of the times we only have so many phones at work. Like every single patient's family member can't call in at once. And we've gotten iPads, which is super cool. They've figured out how to do a HIPAA safe FaceTime call so they can see their loved ones, which are really cool. At first, it's hard to switch it seemed like another thing for us to do, another thing for us to be in charge of, but seeing how cool and how impactful it is, you can just hear your family member, hear their family member's voice or anything like that. It's just so special to get that patient's family that little bit of time with them, because it's not like it used to be where you can have as many visitors as you want. And so that's something that COVID has really changed. But other than that,
that's great. All right. So Sarah, you want to take us over to a live Q&A session. Do we have some questions that have come in from our audience?
Yes. Oh my goodness. So wonderful. Thank you, Hannah and Kelsey, for those answers. So I'm going to go and take a look into the chat here. And here's the first question, and I'll ask it. And then if each of you can just take a moment to answer. I have a question coming in here. Did you have a required class in school that you struggled with? And how did you get through it?
I would say that there were classes both in my undergrad and then in my graduate program that were difficult. I think chemistry was really hard for me in my undergrad, and I got through it just by studying really hard. And reaching out to people that had taken the course before and getting some study tips and just reviewing the concepts that were really difficult for me. Just putting in the time and putting in the effort, because I knew that I needed to take this class in order to apply for PT school. And then I think in PT school, it wasn't so much a certain class that was difficult, but the volume of coursework that was really hard and challenging. So just creating some great study habits, a good study schedule was something that I did early on and stuck to it, and ended up being really beneficial for me. So those are a few things.
I was joking about this earlier, but I was saying what class wasn't. I am not a great test taker. I really have to study so hard to do well in school. I'm way more of a practical learner than like a book learner. And so I would say that almost every class in nursing school is difficult. But I wish I would have learned earlier that it was okay. And by saying okay, like putting my ego aside and getting a tutor, because talking something through with someone that's already taken the class, not your professor, was a game changer for me. The few classes that I had a tutor for were just the classes that I really excelled in, because you were able to talk them through in a practical sense rather than just in a textbook or anything. So don't be afraid to get a tutor. They're so helpful, and that's what they're there for. And with test taking, there's always practice tests, or Quizlet is a thing that is super useful. But yeah, so I would just say that every class was kind of hard, but you get through it by working with other people. And I don't think anybody is meant to learn alone. And just kind of utilizing your resources and taking advantage of the time you get in the classroom, but then also out of the classroom. And a lot of things for nursing school for me clicked once I was in the hospital. I think a lot of times it's hard to imagine someone with COPD or something, and how their lungs being restricted is going to really affect them until you see someone with it and see how debilitating it is, how much the different things that we can do to help, and rather than looking at that on a multiple choice question. So don't be discouraged if you're not getting the best grades. I can tell you that I did not have the very best grades. I was not an A student. I definitely got A's here and there, but you still can go on to be an awesome nurse.
Such great lessons.
It
Do you
is
have more questions, Sarah?
Such great lessons. And what I really liked about what you guys were saying is that, it's hard, but you get to go through it. You get to be your own advocate. You get to go out there and find out what resources are available. So bravo to both of you for doing that. So that actually leads me in to our next question from Carly. She's asking, how did you stay focused to obtain your goal in your field? So let's talk about that.
I think the best way that I stayed focused was just thinking about where I was going, thinking about the end goal. And yes, this work is so hard right now. And no, I'm not at the football game that I wanted to be at because I'm stuck studying. I guess it just, to me, it was nice to know that there was an endpoint in sight and that there were goals that I was going to achieve. I just had to put in a little extra time. And I think it's easy to get bogged down by, thinking so broadly, and this program is 3 years. It's so difficult. I'm not going to be seeing patients for the first 2 of it. So I think set tiny goals for yourself along the way. That makes it a little bit easier, but just finding people that had, similar interests. Hannah and I have actually been lifelong friends since 6th grade. So there are definitely nights that I called her up and, I was super stressed about something, and she just had really great advice for me. And she was always someone that I could lean on. And I think finding those people early on, helped me stay focused, because they always gave me really good advice. Those were, just a few ways, but it's still hard. We always say in physical therapy, you're supposed to be a lifelong learner. You're not going to have all the answers right away, and that's okay. And you might do something wrong, and that's okay. But just continue to grow throughout your years as a clinician, and continue to be vulnerable, and, like Hannah said, put that ego aside, because it's not always about about you. It's about someone else's life and someone else that you're treating. So I think that was always something that I kept in mind, is that it's not about me, it's about somebody else. And that always made it really easy for me to just stick to it, even when it was hard.
Yeah. I would say for me, it was pretty similar of just looking at the end goal. And I can tell you in nursing school, you're going to see people drop out left and right because they either decide that it's not for them or they don't like the coursework or something like that. But I always just look back at why I wanted to be a nurse and how it's worth it. And technology has made it so cool to, with your co-students, I guess, how to work together and have virtual study sessions, or just see that, it sounds bad, but like see that other people are struggling too. You're definitely not alone. And that it's really, you're graduating on your own, but you're not graduating on your own. You're graduating with people who have been through the program with you. And I kind of like what Kelsey said, constant learning. I have coworkers that I see that I'm like, I'm never going to have that much knowledge. I'm never going to remember exactly what to do, but every day it gets a little easier. And you feel like you learn more and more. So yeah, just kind of sticking with it and be confident it's what you want, because it's a whole lot of school to go through if you're not sure what you want to do. But like I said, there's so many different ways you can make a difference as a nurse or a physical therapist, or really anything in the medical career.
That is such great advice. It's like, keep that why right in your sights. Get yourself surrounded with people who can support you, your go-to people. Have those micro goals so that you can have those wins, because it is really a marathon, right? It's a marathon.
Yes.
And so I think that is just tremendous advice. So we do have another question that's come in here. Let me read this for you. Was there a defining moment that pivoted your life to pursue this career? What was that? Or who was that made that difference to set you on this career path?
I'm going to be super honest and say that there wasn't a certain thing that really drove me to this career. When I was in my undergrad, I loved the stability of it. I loved being able to have a flexible schedule because I've always wanted a family. That's something that I've always wanted to be able to, have my job, but also raise kids on the side. So that was really what drew me to it. And then as I started, more seriously looking at the career, I absolutely fell in love with every single part of it. And there are still portions of being a physical therapist that I'm learning about and falling in love with all over again. And so as I entered school, it was super hard the first year. And I definitely had my doubts, like, oh my gosh, should I be here? Is this really what I want to do? I don't know. And there was something inside me that said, stick with it. You're in the right place. And so I felt super blessed to have that reassurance. And then as I got to the workforce this last year, this third year, it's just been the small patients along the way. Some you get along with and some really don't like you when you tell them that you have to get up and do some physical activity. And that's okay. They yell at you, you get out of sessions, and that's fine. But then there are some that really just make a difference. So I think all of them stick with you, not just the good ones. Because the bad ones certainly have too. So it wasn't a certain event that drew me to it. It was all around the whole thing. And I feel super blessed that I just keep falling in love with it every day.
Yeah, for me, I had some medical issues growing up. Never anything crazy serious, but enough where I had to go to Mayo Clinic and see some specialists, and seeing their level of care for me and my family made me really interested in going into the medical career or the medical field. And so, like I said, I was really blessed that I kind of knew what I wanted to do, like all through high school. But doesn't mean that that's going to be the same for everyone. I know that nursing, I have lots of coworkers that nursing is their second degree. They went to school for honestly anything and discovered that it wasn't for them, or it wasn't what they thought it was going to be. And the nice thing about a nursing degree is once you get your generals done, it's still a bachelor's of science. And so as long as you have those prerequisites done, you can get a nursing degree done in like full year round. I think it's like 16 months or no, I don't know. Around
Not 4 years. Not another 4 years.
Exactly. And just seeing how many people are rewarded from doing that. So if you don't pick the right degree, it's not the end of the world. And there's lots of opportunities to go back to school and further your education or change your career field or anything. Don't just settle for something that you kind of like or that you're really excited to go home at the end of the day.
All right.
That is so great. Thank you so much for both of you sharing. I'm looking here at the comments. I think that was the last question that we had come in. So thank you very much. And Amanda, I'll give this back to you.
Yeah, before I said we were on our final question, and I remembered that I put this one in. In closing, I'd love to hear any final words of advice to young women that are considering a career in healthcare, but maybe are unsure where or how to begin.
I would say that was where I was. For the first 2 years of my undergrad, I was doing an exercise science degree, and I loved it because I was passionate about it, but I really had no idea where I wanted to go as a career. So I ended up just reaching out to some physical therapists that I had worked with as a dancer. I had a few injuries and gone to physical therapy, and I emailed them and I said, hey, can I come in and shadow you at a day at work? Can I see what you do? See if it's something that I'm interested in. And so I think don't be afraid to email those people, whether they're students like me or, early professionals like Hannah. Find those people and get connected. Don't be afraid to email or call or, text, whatever, to get those questions answered and to get your foot in the door. And then I think just as you start that education, trust yourself and trust your skills, trust your gut knowledge that you had and that you're gaining, because confidence can make a big difference in healthcare, especially when you're dealing with other people's lives and you're treating other people. I think people like to know that you're confident in what you're doing. And even if you're not entirely sure, tell them that you'll get their questions answered eventually. I had a patient yesterday who asked me a question that I didn't know the answer to. But I told her, to be honest with you, I don't know the answer, but I'm going to get it for you. And when you come in on Friday, I'll have the answer. And she was like, oh, okay, great. So I think just be confident and be honest with yourself and with your patients and their families. That would be my advice.
Yeah. Honestly, I feel like I kind of gave all my advice already, but I can circle back around. I'm very famous for avoiding the real questions. So, but I would say just start some science classes, kind of like Kelsey said, get your foot in the door, not with COVID right now, but shadow people, talk to family members, coworkers. Even in the medical field, it's still all about who you know. And just getting your foot in the door, whether that's a good way for nursing is actually to get your certified nursing assistant and work in the hospital setting or the nursing home setting and just seeing what it's like. Because even though you don't have the capabilities of a nurse, you are working hand in hand with a nurse and can see what it would be like. And it doesn't help or it doesn't hurt that it looks great on your resume. And yeah, just kind of just follow your gut, like Kelsey said. it's never too late to try something new or too soon to start looking. I know I was the first child, so my mom had me looking at colleges as a freshman.
Me too. She had me looking as well.
Yeah.
That doesn't surprise me.
But yeah, I don't know. Just keep going and follow your gut. Yeah.
Thank you guys so much, Hannah and Kelsey. This has been so wonderful to hear your authentic story, what it's like, what it takes, and your honesty about it. That's what I think our viewers really need to hear, is that it's not always going to be easy. It is going to be a hard road. If we can keep focused on the why, all of these things that you have shared today, I think are really great advice. I think this is going to help for people to listen to this and know how they can get their goals accomplished in the future. So we really thank you guys for being on here today and really coming on here and trying something new with us, right? And as we've reimagined our panels, right? Now we're here live. This is the format that we want to use going forward. We appreciate the viewers that have tuned in today and answering your questions. And we really appreciate all this time and energy that has gone into this. So this is only the beginning. So you can see we've got our slides up here. We are asking people to follow us, and we will be posting this video will be available to watch again after the live stream, so it'll be available. But make sure to follow us on social media and connect with us or ask us some different questions. But again, I just want to take a moment to thank Hannah and Kelsey. Again, thank you so much. Thank you for coming to this space with us here today. And we just want to acknowledge you for making your mark on the world in healthcare and helping people. So I thank you so much for being here today.
Yeah, thank you so much. I really appreciate your time and your thoughts and your advice and encouragement to young women out there. As Sarah mentioned, this is just the beginning for Trailblazers Live. We've got visions of bringing in other panels and technology, individuals that are focused on climate change and the environment, careers that are in the fields of software development or, manufacturing, construction. So follow us on social media to stay connected or posted to the efforts behind the scenes as we're prepping the panels and the roster for the 2020 and 2021 school year. Also, if you are or someone you know is a blazing woman in STEM, we want to hear from you. If you'd love to appear on one of our panels, shoot us over an email at trailblazerslive@keyot.com to connect with our team, and we'll be in touch. Trails blazed. Thank you so much for joining us.
Trails blazed.
Bye.